So we can distinguish between the anatomical effects of pregnancy as well as the physiological effects of pregnancy. So when we look at the anatomical, obviously the uterus is going to expand during pregnancy because that is where the developing fetus is. So the uterus enlarges. And at the end of pregnancy, it is going to almost fill up the entire abdominal cavity. So if we look at a diagram that shows this amazing change in the size of the uterus, this is a diagram here before the female is pregnant. We have it, the uterus sitting right about here. And notice that it is underneath your umbilicus, which is the navel. So you'll also notice that the mammary glands are not well developed because it is prolactin, which is going to cause the mammary glands to swell and cause the enlargement of the breasts. So at 4 months, it almost reaches the umbilical. Here it is above the umbilicus, and at 9 months, it actually reaches that zygoid process. And so this is gonna like push all of the other organs out of the way. So sometimes it makes it difficult for females to breathe because their diaphragm doesn't move very well. It also could lead to digestive discomfort because of the stomach being pressed. It could also maybe lead to hiatal hernia, where the stomach actually comes up above the diaphragm because it's being pushed. And that can lead to gastroesophageal problems where you have acid reflux. So that is one of the major anatomical changes that we see in the females. We also see, based upon the levels of estrogens, as they increase, we can sometimes get a darkening of the skin around the nipples, the areola. And then you can also see sometimes a darkening on the face. So sometimes they call this the pregnancy mask, where you get dark skin on the face and maybe on the neck, and then also on the belly. And so we see with these increasing estrogen levels, let's go back to the topic here. We see increase in estrogen leads to increase in breast size in preparation for lactation, but it also can cause an increase or a darkening of the skin. And a darkening of the areolar region around the nipples. We also have a hormone called relaxin, which is aptly named because what it does is it's actually going to cause the pelvic ligaments to become looser. So this causes, it's produced by the placenta, and it causes the ligaments around the pelvis to loosen. So it might feel like the pelvis is loose when you're walking. So you might have problems with pelvic alignments, and that might lead to some pain associated with walking. But this is going to be really important because during childbirth, that pelvis needs to allow the head of the fetus to move out. And so it needs to be able to expand a little bit. We also, so this is produced by the placenta. The relaxin is produced by the placenta. We also see that we tend to get an enlargement or swelling of the reproductive organs. So maybe the external genitalia. So they might swell up because of the estrogen. And then we also get weight gain. So the average weight gain is about 28 pounds with pregnancy. 28 pounds. Now, physiologically, we have differences in hormones. So for example, physiologically, we could get morning sickness. And I mentioned that some people believe that might be due to high HCG levels. We might have heartburn, which might be due to the uterus pressing on the stomach. We might have more urine to process. So more urine to process. And so we might urinate more. And this could also be because the uterus is pressing on the bladder. And so it might make us need to urinate more. So you have an increase in urination. And you might also have difficulty breathing. Based upon those anatomical changes we mentioned before. Excuse me. And the big change is that you might have, or you do have, a massive increase in your blood volume. So increase in blood volume, because you're having to supply the developing fetus with oxygen and nutrients. So you can increase by 25 to 40%. And so sometimes this increase in blood volume could potentially lead to an increase in blood pressure. Increases in blood pressure can be dangerous for pregnant women, and it is generally referred to as preeclampsia. So this could increase blood pressure, and this could be preeclampsia. So oftentimes, if a female has really high elevated blood pressure and she's near the end of her pregnancy, the doctor might decide to induce in order to make sure that her blood pressure doesn't go too high, because that blood pressure could damage blood vessels, it could damage your kidney, it could damage the fetus. So you want to really make sure that you keep tight control of the blood pressure.